Hi, pet parents. I'm Dr. Pamela Dragos. I'm a holistic veterinarian that specializes in valley fever. I've had 4 dogs with valley fever, and I've had valley fever myself a couple times. And we're going to talk about valley fever, and it's an emerging orphan disease. So, what the heck is valley fever? It's a fungal infection that is common in the southwest United States in desert areas. It causes flu-like symptoms such as coughing, fever, lack of appetite, lack of energy, and it affects all mammals, people, dogs, cats, horses, dolphins, all mammals. But why is it called an orphan disease? It's kind of a weird little name. Um, an orphan disease, the definition of an orphan disease is a disease that affects fewer than 200,000 people in the United States annually. And these diseases are typically difficult to diagnose and difficult to treat, which is a great definition of valley fever. Although it may not be considered an orphan disease depending on who you talk to, because technically they're seeing about 150,000 people in the United States infected annually, but research are seeing more like 350,000 people annually being infected with valley fever. And one of the reasons there's such a discrepancy in those numbers is because valley fever commonly gets misdiagnosed as other things. It gets undiagnosed because parts of the country just don't even know about it and they don't know to test for it, or it just doesn't get reported. So let's go over some valley fever statistics. And these are for people. There are a lot of statistics for people, not a lot for dogs, but suffice it to say that the numbers are very similar in dogs. In fact, it may be even more in dogs, but similar percentages. So for decades, valley fever was confined to Arizona and Southern California, but now it is spreading east all the way through Texas and north up to Nevada, Utah, Oregon, and Washington. So we're seeing cases all throughout the western United States. And interestingly, or scarily, the researchers are projecting that by the year 2095, valley fever will be endemic throughout the entire western United States. And this is basically because of climate change or global warming. The climate is making the soil more conducive to fungal growth. So infection rates are rising. This is a chart for California, and California has seen an 800% increase in valley fever infection rates since the year 2000. It's just booming. Arizona accounts for 2/3 of the cases that are reported for valley fever in people. But the caveat here is that we're a mobile society. So you can live in Arizona or the states that have valley fever endemically, or you can just travel through or visit the area and you unknowingly get exposed to the fungal spores, and then maybe you go home and then break with an infection 3 weeks later. And nobody will know what it is, because if you live in a state like on the eastern part of the United States, the physicians and the medical community just are not aware of valley fever. They don't have it on their radar, so they don't even know to test for it. So you present with these flu-like symptoms and maybe pneumonia, and they don't know what it is. So they commonly treat it as a bacterial pneumonia, but antibiotics don't work for fungal infections, so you don't get better. So how do we and our pets get infected? Let's look at the valley fever life cycle. Let me get a little cursor here. So the valley fever fungus lives in the soil, and during the rainy season, it multiplies. And you have these little arthroconidium inside the mycelium, which are the filaments. And when the weather dries, when it gets really dry out, the arthroconidium, or the little spores, break off into the air. And so they become airborne, and they can go one of two places. They can either go back, in the air and back into the soil and grow into more mycelium of the fungus, or they can come out here and get released in the air, and then somebody breathes them in. A dog, a cat, a horse, a dolphin, a person. You breathe in the spore, and normally if you have a good immune system, your body will realize that spore and take care of it. But if you don't, in the lungs, the spores grow into spherules, and these are a yeast-like stage of valley fever. And the spherules contain endospores, and they grow larger and larger in the lungs until the spherule bursts, releasing all the endospores in the lungs and spreading the infection throughout the lungs. This is an x-ray of a dog with valley fever pneumonia, and this is a chest x-ray. So we've got the dog laying on his side. His head would be over on the left of the screen, and you can see this is the spine at the top with the ribs coming down. And you see this black tube, which is the trachea. And then right where the trachea ends and the major bronchi of the lung start. So the trachea separates into the two lung fields. We see this white area, which is a pneumonia. And we also see a white area here, which is a lung lobe that has pneumonia in it also. Normal lungs will look black like this over here. This is more normal for the lungs. And so this is all the lung field in here. All right, so here's some stats on pets. Dr. Lisa Shubitz did a study. She's a veterinarian that specializes in valley fever, and she's with the Valley Fever Center for Excellence in Tucson. And she did a study and found that 6 to 10% of dogs in Arizona will become sick with valley fever annually. And their risk of infection was greater if they lived outside or were outside a lot, and also if they had large areas to roam. The other thing she found was that dogs raised from puppies in Arizona had almost a 30% chance of being infected with valley fever by the time they were 2. You have to remember that of those 28% that get exposed or infected with valley fever, only 6% become ill. Which means only 6% of the dogs that breathe in the spores from valley fever will get a pneumonia or get really ill from the fungal infection. And she estimated that 4% of all U.S. dogs will become sick with valley fever every year. All right, so what now? Let's talk about valley fever a little bit more in depth. Valley fever is the great pretender. So it's a fungal infection. We talked about that. It grows in the soil, and you can breathe in the spores. And it's in the Southwest United States primarily, but it is spreading. So the symptoms, your first symptoms are things like lethargy, cough, fever, chest pain. It's a very painful infection. Achy joints, muscle aches, loss of appetite, and then eventually weight loss. And those are the early symptoms. So basically, they're flu-like symptoms. They're very general, they're very vague, which is one of the reasons why it's a great pretender, because it can look like other things. So if valley fever goes through this acute stage or early stage, and the dog or person's immune system doesn't handle it, then it can spread to other parts of the body. And that's called disseminated valley fever. And so we'll see things like lameness or limping or swelling of bones when valley fever goes to joints or bones, which is actually a very common location for it to go. It can go to the kidneys and cause kidney infection. That's glomerulonephritis. It can go to the liver and cause liver disease. It can go to the lymph nodes and cause swelling of the lymph nodes, which can mimic other diseases. It can go to the spine and cause weakness or paralysis, or even just horrendous neck pain and back pain. It can go to the brain and cause seizures. Or I have seen cases where the valley fever went to the brain and caused vestibular disease, which is a balance problem. The really severe infections in the brain are called encephalitis, and that's where the dog or the person just doesn't know where they're at and who you are or anything. It's a severe form of valley fever. Valley fever can also go to the skin and cause abscesses, or it can cause some oozing sores, especially over the lesions or the infections in the bones. Valley fever can go to the eyes and cause inflammation and pain. It's been known to infect testicles. Yeah, that's no fun. It can go to the heart and cause an arrhythmia, which is an abnormal heartbeat, or it can cause a pericardial effusion, which is where you have fluid around the heart within that pericardial sac, and that puts pressure on the heart, and it can happen all of a sudden, which is usually how a dog will die from unexpected heart failure or sudden death. It's usually when it goes to the heart. Scary stuff. Let's see. All right, let me move myself over here. So what makes valley fever so tricky to diagnose? So there's a long list of symptoms, and they can be very vague and non-specific. They can be similar to other diseases. And the testing for valley fever is not super accurate. There are a lot of false negative valley fever test results, meaning a dog will have valley fever and the test will come back negative. So we have to use other ways to diagnose valley fever. So one of the things that valley fever can mimic or look like is kennel cough, because kennel cough causes coughing and trouble breathing and lethargy and fever and lack of appetite and eye discharge, and it can also lead to pneumonia. So kennel cough is commonly diagnosed in early valley fever cases when someone is not aware of valley fever or not testing for it, because a dog will come in with these symptoms, and the symptoms are the same between valley fever and kennel cough. So unless you test for it or know what to look for, a lot of dogs get misdiagnosed with kennel cough. It also gets misdiagnosed as bacterial pneumonia. And this is what actually happened to me. I ended up in the ER with pneumonia. And in Arizona, which is like the most endemic state for valley fever and the ER physician diagnosed me with bacterial pneumonia when I really had valley fever pneumonia. So again, very vague, similar symptoms: lack of appetite, lethargy, weight loss, trouble breathing, cough, fever, same symptoms. So that's why it gets misdiagnosed. And this is an x-ray of a dog with bacterial pneumonia. And it looks very similar to the one we saw earlier that had valley fever pneumonia. So this is a bacterial pneumonia. And same view with the dog laying on his right side with his head off the left side of the picture, with the trachea coming down and that white area right where the trachea ends and the bronchi go into the lungs. So that's a bacterial pneumonia. So you can't even diagnose it off an x-ray or determine between the two off an x-ray. The other thing that valley fever will look like and gets misdiagnosed as is arthritis, because valley fever will cause limping and lameness, stiffness, difficulty rising, pain, and arthritis and valley fever cause the same kind of symptoms when it goes to the joints or the bones or even the spine, because the valley fever in the spine can look like just a back or a neck pain. And if it's severe, sometimes it looks like IVDD or the intervertebral disc disease. This is Spencer. He's a little patient of mine. And when I saw him, he was 15 years old. He's now almost 17 and he's still kicking. He's a neutered male Pug Boston Terrier mix. And he had been arthritic for several years and had mobility issues. But he had gotten really worse in the last couple months before he came in to see me. And he started panting like mad. He was lethargic and he had excruciating neck pain, and he was holding up his right front leg. And the vet that she went to initially just told her that, he's an old dog, he's got arthritis, here's some drugs. And the pet parent didn't want to give him drugs, for one thing. So she seeked out a holistic vet. So she showed up in my office with little Spencer, and I looked at him and I'm like, this is bad. Like it looked like IVDD of the neck, because they'll have really bad neck pain, and he was like scrunching his shoulders up to his ears. He couldn't even move his neck. He was so painful. And with IVDD, when you have nerve pinching from a disc prolapse in the neck, you'll see them lift up a front leg because of the nerve pinching in the neck. So I actually thought it was IVDD at first, and treated him with acupuncture, a little bit of chiropractic, herbs and supplements, and we talked about diet therapy, and he got better. But the third time I saw him, he was still having trouble. And usually with neck pain, after 3 acupuncture treatments, they get remarkably improved. And he was not as improved as I'd like him to be. So I told her, there was something else going on. So I sent her back to her regular vet for a valley fever test. And the regular vet didn't want to run it. She said it was a waste of money. He's just old. He doesn't have valley fever. And the pet parent advocated for Spencer and persisted and got the test run, and it was positive. And he's doing great now. So another issue that valley fever can look like is hip dysplasia. And hip dysplasia can cause pain, lameness, difficulty rising, difficulty jumping. But so can valley fever. This x-ray is a dog with, I would call a mild to moderate hip dysplasia. This x-ray is of the pelvis and the legs. And the dog is laying on his back and his head is up on the top of the screen. So head is headed up to the top, but this is the pelvis and the hips. There's a hip, there's a hip, and the legs are pulled down. You've got the knees down here. So with hip dysplasia, we look at the ball and socket joint here, and we want 50% of the ball or the head of the femur within the joint or within the acetabulum. And he's only about maybe 25 or 30% in that acetabulum, which means he's got a very shallow socket or a shallow acetabulum. That's hip dysplasia. So this is Captain. Captain is a dog I saw. He is an 11-year-old neutered male golden doodle, and he was diagnosed at 11 years of age with hip dysplasia. And that can happen because hip dysplasia can be so mild that you don't know your dog has it until they develop arthritis in the hips from all the excess movement of the in the joint. And then you'll see symptoms of the pain and difficulty rising when the arthritis sets in. But that was not the case with him. His x-rays, by the time I got his x-rays, which were kind of late in the game after I had been treating him for dysplasia, and he was actually getting better as far as being less painful, but it was probably like 3 or 6 months into being treated, he showed up so much worse and in excruciating pain, and I couldn't even touch his hips to do an exam. And again, I sent her back to her vet to have a valley fever test because that just was not normal. Usually with holistic care and acupuncture, things get better, and if they're getting better, they continue to get better. They don't get better and then crash. So she had a valley fever test done on Captain, and it was positive. And then I had gotten a hold of his x-rays, and his x-rays looked nothing like the ones we just looked at. His x-rays actually looked normal to me. So another misdiagnosis, but he's doing great because he got the right diagnosis. So unfortunately, this is really common, and this kind of stuff happens with people too, which is just as bad. So here's another bad one that happens with people and dogs and cats, and is valley fever can get misdiagnosed as cancer because it will look just like cancer on an x-ray, on a CT scan, on an MRI. Things like lung tumors look just like valley fever in the lungs. So this x-ray, here's the one on the right is the same view we've been looking at of the chest with the dog on their side. And the arrows are pointing to this circular area within the lungs. And that is a valley fever granuloma. So that's a valley fever infection. But that's what lung cancer looks like too. So that kind of thing will get misdiagnosed as lung cancer, especially if they don't test for valley fever or if they don't do a biopsy. Other kinds of cancers that valley fever will look like are brain cancer, because valley fever causes lesions in the brain. Swollen lymph nodes will get mistaken for lymphoma. Bone swellings get mistaken for bone cancer. And then eye inflammation gets mistaken for cancer in the eye. This is Kit. Kit was a 6-year-old spayed female Shiba Inu. She's still doing great, by the way, that had masses in the lungs. She had 3 masses in the lungs and had a CT scan and was diagnosed with lung cancer. And when she came to see me for cancer treatment, she actually came to see me for holistic cancer treatment. I looked at her and she did not look like a dog with lung cancer because she was so painful. She was so painful in the chest, and it hurt her to breathe that she would take these little tiny breaths, and she was tense all over her body. She she was so painful. And granted, lung cancer can be painful, but I have not seen lung cancer at that level of pain, but I have seen valley fever with that level of pain, and I've experienced it. So it does feel like that. It's excruciatingly painful. So this was an interesting case because she had been tested for valley fever and it came back negative. And the vet had done a trial treatment with valley fever medication where we put them on fluconazole, which is the medication for valley fever, a really common one. We put them on fluconazole for a month, and if they get better, then we suspect valley fever. But what we also do is after we do that trial treatment, we also retest, and that wasn't done with her. So she was placed on fluconazole for a month, and the pet parent didn't feel like she got any better. So just chalked it up to cancer, not valley fever, but they never rechecked the test because a lot of these guys, when they test negative and you trial treat them or give them a trial of the medication for a month or so and then retest them, some of them will then turn positive on the blood test, and then you've got a diagnosis. So pet parent did not want to do fluconazole. And so what we did is treated her holistically with herbs and supplements and diet therapy and acupuncture and chiropractic for valley fever. And those 3 masses in the lungs shrunk down to nothing. And to this day, she's still doing great. All right, so those are the scary misdiagnosed cases. So how do we diagnose valley fever? So with all these weird variations and symptoms that look like other things, how do we diagnose it? So the first thing that's usually done is complete blood testing. And a Coxie titer is a valley fever blood test, and that's the most common test, and sometimes that's the only test that's run. And if it's positive, great, we have a diagnosis. If it's negative, we may or may not have valley fever because there's a lot of false negative tests. So what I usually do is not only do I run a valley fever titer, but I also check other lab work. I check a complete blood count, which looks at the blood cells. I check a chemistry panel, which looks at liver, kidneys, electrolytes, proteins, glucose. I look at a thyroid level, which is a T4, and I look for the tick-borne diseases and heartworm disease, which is the heartworm 40X test, which tests for Lyme's disease, tick fever, as well as heartworm, and anaplasma, which is another tick-borne disease. And then for some of the more serious cases, we may need to do some more advanced testing. So when it goes to maybe the spine or the brain or the heart or the bones, there are other tests that may be indicated other than the core tests we just talked about. So a urinalysis can help if it's maybe a kidney infection. A respiratory PCR is a nice test, and I may have put that on the core testing because a respiratory PCR test tests for things like kennel cough, influenza, distemper, things that will cause, or infections that cause respiratory problems that will mimic valley fever. So, if a dog comes in and it looks like it's got kennel cough, some vets will actually test, do a respiratory PCR test to confirm it's kennel cough. And if all those tests are negative, like for kennel cough and influenza and distemper and the other respiratory infections, then we need to be looking at other things like valley fever. So that can actually help us with the diagnosis in the early stages, especially. X-rays are another thing that are commonly done. Sometimes they're done right away. Sometimes they're not done until the dog is more advanced. But chest X-rays or X-rays of a bone or a joint that's painful, or the spine. And another test or tests that are commonly run is an MRI or a CT scan. And this is usually when there are problems with the brain or the spine or the neck. And they'll usually do a CSF tap at the same time, which is a cerebral spinal fluid tap, because sometimes you can find the valley fever spores in the fluid. They can actually test the fluid also. And then sometimes biopsies are done, like a lung biopsy or a bone biopsy when you have a lesion in the bone that you're not sure if it's valley fever or cancer. And then there's a fungal PCR, which tests for all the different fungal infections, because there are more fungal infections than valley fever. And it can have some similar signs. For example, I had a patient with a lesion in the bone, and we're trying to figure out if it was valley fever or bone cancer, and the valley fever test was negative. So they did a bone biopsy, and it actually came back fungal, but it was not valley fever, it was aspergillosis. So this fungal PCR test is a blood test, which is non-invasive compared to a biopsy, that you can do to find out if it's one of the other fungal infections before you get to the biopsy of the bone, which requires anesthesia and can be quite uncomfortable. All right, let's see. So basically, valley fever is a bizarre fungal infection. It's in the Southwest United States. It's spreading throughout the whole Western United States due to climate change. It's more common than you realize because of that. It is difficult to diagnose because we have a lot of false negative tests, and it mimics other diseases because it has very vague general signs, flu-like symptoms initially. It's tricky to treat, requires antifungal drugs, and there are about a half a dozen antifungal drugs that can be used. Only about 3 or 4 are used in dogs. And then making awareness about valley fever and advocating for your pet to get tested if you feel like they have symptoms of valley fever is critical to a good outcome. So they actually did a study on that. So when people know about valley fever, they're more apt to advocate for themselves or a family member or a fuzzy family member. And those patients will have better outcomes because they were aware of the infection and they knew how to advocate, or they just did advocate. All right, so here is the at-home valley fever testing bundle that I told you about, and you can access it at www.caninevalleyfevertest.com, and it basically has all the core tests that I talked about: the CBC, the chemistry panel, the thyroid test, the valley fever titer, and the heartworm 40X test. And this is a comprehensive test, and this particular lab will come to your home. They send 2 techs to your home to pull the blood and submit it to the lab, and then send you the results. And they'll also send your vet, or whatever vet you list on the form, they'll send them the results too. So this is an at-home valley fever testing bundle. And go to caninevalleyfevertest.com and you can access the test, and you can also access my membership site, which has information on how you can get started improving your dog's immune system even before you get the test results back. All right, so thanks for listening, and I'll talk to you later.